Hi everyone, it's Dr. Matt Serrick here from Back and Balance Clinic, and today we're going to talk about what a chiropractic adjustment is. There's a lot of preconceived ideas as to what actually an adjustment is and what its effects are or are not. So stay tuned as we talk about the chiropractic adjustment. An adjustment, also known as spinal manipulation, is a treatment modality that most chiropractors are known for. It's a type of manual therapy where a chiropractor uses a high velocity, low amplitude thrust directed at a joint, usually of the spine, near the end of the passive or physiological range of motion. An adjustment is a form of joint mobilizations, which are a type of manual therapy that are used to increase the range of motion of a joint and are categorized according to their intensity, going from grade 1 to grade 5. Non-thrust mobilizations use low velocity, passive movement techniques of varying intensity within the patient's range of motion. As the grade of the mobilizations increases, the closer to the passive end range a joint you are working. An adjustment is a grade 5 mobilization as it uses a high velocity, low amplitude thrust past the end of a patient's passive range of motion. There are a couple of modes of action as to how manipulation might work that are both biomechanical and neurophysiological. The biomechanical theory suggests that it acts on a dysfunctional or stuck joint, and the manipulation treatment is designed to reduce internal mechanical stress. This essentially means that the adjustment or manipulation increases the range of motion of that particular joint that was previously not moving correctly. The neurophysiological approach suggests that the adjustment affects nerve cells that are located in the muscle tissues, the motor control system, and the pain processing system within the spine. This means that the adjustment causes changes in the sensory neurons of the joint and surrounding tissues to help reduce your pain. Potter, McCarthy, and Oldham in 2005 published a review on the proposed theories on spinal manipulation, with theories including gapping of the joints, improving range of motion, decreasing muscle hypertonicity and tone, and altering pain perception. It could be that spinal manipulation exerts its effects by any combination of the above theories, but more research is needed. You will notice that there is no mention of pushing a vertebra into place or correcting a misalignment. Spinal manipulation doesn't work like this. However, often what we think is a misalignment of our spine is really a tight or restricted joint. It is also possible that segments are moving too much, which causes the feeling like something is out of place, but physically there isn't a misalignment. Your spine is strong and does not misalign from everyday activities. In 2019 meta-analysis, Rubenstein et al. Looked at the harms and benefits of spinal manipulative therapy for the treatment of chronic low back pain. The results concluded that the observed effects were similar to those of other recommended therapies, including exercise and non-steroidal anti-inflammatories, and it appears to be better than non-recommended interventions such as light soft tissue therapy, electrotherapy, or no treatment for short-term improvement in function. For acute pain, a meta-analysis by Page et al. In 2017 concluded from 26 randomized controlled trials that spinal manipulation was associated with a statistically significant benefits in both pain and function. Overall, chiropractic care has been shown to be extremely safe and effective for a number of conditions. However, there are some side effects to consider. Some minor side effects include increased pain, muscle stiffness, and headache, but these are often transient in nature and do not last long term. Some major side effects that have been reported include worsening of disc herniations, rib fractures, and exacerbation of stroke symptoms. Although these risks are highly unlikely, it is worth discussing them with your chiropractor prior to undergoing spinal manipulation. Overall, spinal manipulation can be a great tool for some people when it comes to their pain. Ask your chiropractor or healthcare provider if it is an option for you. It should not be used as a one-size-fits-all approach for everyone, but can be very helpful as part of a multidisciplinary treatment for certain conditions, along with education, exercise, and muscle therapies. Thanks again for watching another one of our videos, and check out some of our other videos here. If you have any questions about what you saw in the video or have a suggestion for a future topic, please comment down below or reach out to us in clinic and we'd be happy to hear from you. Also, please don't forget to like this video and subscribe to the channel so you're the first to know when new content comes out.